Hello, everybody. It is SITREP 15 on this nibbly Sunday, 17th of November, 2019. So, we don't have any welcomes for today, so I'll skip over that one. I have one correction. SITREP 14, I was talking about the Veterans First program that President Trump had implemented. Actually, it has nothing to do with what I was talking about. Veterans Choice is what I was talking about. Remember, I was talking about, the possibility or the situation where if the VA can't treat you, then they go through the Veterans Choice program, and that's where the one part of the VA validates that you have a need for the service, that the VA can't provide it to you in a timely manner, and then they contact. They find a local place that can give you the treatment, and then you actually get to select which one that you want to do to, which is pretty cool. So anyway, Veterans Choice, not Veterans First. Veterans First is some kind of mortgage thing. It's not even affiliated with the government. It just sounds like it is because that's what they do. Symptoms, omissions, additions, and updates. So one thing, my right ear pain has kind of gone away, and the weird thing was when I would use a Q-tip. When I use a Q-tip, kind of get in there to get the water out of the hole, which you're not supposed to put anything bigger in there than your elbow. Yeah, right. It would hurt and then get more intense, and then kind of go away. Just like if you'll smack the back of your hand, like the pain you feel initially isn't all the pain you're gonna feel, and then it crescendos and it goes away, right? So it's kind of like that, but it's kind of gone away. So apparently the induction chemo worked on in that regard, and I found myself weirdly, like out of nowhere, chewing on the right side of my mouth again, which I hadn't done in a while. That was about a week ago, so that's awesome. Now I can chew on both sides again, which is cool. And no sooner did I mention no more burping out of my my G-tube hole, I started burping out of my damn G-tube hole again. But it only lasted a couple days and then went away. So I don't know why. I don't know why that happened. It's like, I don't know. It's such a strange thing, like out of nowhere. And that massive ringing that I was having in my left ear, that's gone. So now I'm just back to the normal ringing I have in my ears, which again is just from damage. It's actually, by the way, it's called tinnitus, and it's not caused by damage to your ear. It's actually damage to your central nervous system. So I have hearing aids my hearing aids I wear because for the left ear I have hearing loss, but also these hearing aids have 3 different modes. One of them is regular, just hearing aid alone. One of them is chimes alone, and one of them is hearing aids and chimes. The chimes are kind of like these soft, like bling, blang, bloom, bling. These different like notes of these real soft chimes, and it changes between ears. And supposedly that keeps your central nervous system busy. So your subconscious focuses on the chimes instead of this issue that makes your ears ring. But oddly enough, if I take those off for any period of time, I still hear the chiming in my ears, which is really weird. But that's the hearing aids that I have. And one thing, this is kind of weird, but I'm just going to mention it. One thing I noticed when I first went to the infusion clinic, the hematology oncology clinic where I got my induction chemo. When I went to the bathroom there, because they're pumping you full of liquids, it's a thing on the door that says infusion patients, please flush twice. And I asked the nurses about that, and they said, yeah, because there's so many, the stuff the chemo that they're putting in you is kind of like, it's pretty toxic, right? So I'm like, it's okay to be inside my body, but I can't splash a little bit on the seat and somebody else get it on their skin or whatever. But anyway, that sounds kind of gross, but you know what I'm saying. But I've been practicing that at home as well. So I have the dual flush toilet. So I have the big flush and the little flush. I just hit the little flush twice and take care of that issue. So I thought that was kind of neat. I also started my fluoride. So the VA gave me these trays, top and bottom. And technically, I don't think I was supposed to start them until I start radiation, because radiation, like I said in one of my SITREPs past, it really attacks your teeth and your mandible, your jawbone, and all that, and everything else as well. But especially those things. So they give you fluoride, and so I started doing that about 3 nights ago, and I have to do that twice a day. That's once like late morning, like after breakfast and stuff, or just after lunch, and once before bed. And I have to do that twice a day for the rest of my life. So I have to floss, brush, and do these fluoride tray treatments at least twice a day. So that's that. SITREP on the sleep lab. Remember I was talking about my CPAP mask and the strap, the harness, the 2 straps that come around the front go right over my right jaw and throat area where I'm having these issues. So I would have had to go to the sleep lab on a walk-in, which is what I was talking about, Monday through Thursday, 9 to 11 I think it was. And then I had to go there, wait around, finally get seen by a sleep technician, and then explain to them that we have to go over to prosthetic guys to have this harness re-engineered. And I can imagine that turned into a whole fiasco. I said, you know what, let me take a look at this on my own. So I had some old harnesses, so I just basically cut one strap off, flipped it around to make it a loop. That's one that has the metal clip here, and I sewed it. I just hand sewed it, and I just thread it through. So now I can bypass. I don't have to use the one down here. It actually attaches in front of my ear and goes down and connects here to the front of the mask. And then my other one takes the normal route, and it goes, and there's my script, and it goes the normal route from below my ear across my jaw to the front. And it actually holds it securely enough to where it maintains a solid seal, and it's not running across my jawbone. So it's actually helped a whole lot. So it's pretty sweet. So my upcoming appointments, my radiation starts tomorrow morning. Actually, it's afternoon. I go in again, it's Monday, so I go in for my chemotherapy in the morning, and that's like 4 hours. That's only on Monday, and then I go for my chemo later on. So we'll see how that goes. I can't wait to get it started, part of me, but just the unknown's kind of like, I don't know what's going to happen. I mean, radiation can really, it's different than chemotherapy. Chemotherapy, the symptoms happen so arbitrarily in people, but generally speaking, radiation, I mean, it's getting shot right there. So again, your salivary gland, your tongue is in play, all the jawbone, the whole thing. And one of the issues is, one of the things about having problems with your head and neck is, especially your mouth area, if you think of it like a house, right? You have the outside walls, which is, just your cheeks and your skin over your face, right? That's like the outside walls of your house. But if you think the inside structures of your mouth, especially like your soft palate on the roof of your mouth, that's like a wall inside your house, right? The mouth side of it is just one side of the wall. But on the other side of that wall is the dining room, right? Up there you have your nasal cavity. So you have this one structure that affects both cavities. So, and also one other thing is, your tongue. Your tongue is like an inside wall. I mean, it's got several different sides, right? But you don't realize that when you speak, your tongue drags across your bottom teeth. It hits at the sides, your side teeth, your molars, side teeth. I'm making up words here. It hits your molars. So, one of the major concerns that I have, and it's pretty common, is to get sores on your tongue. So it affects eating, it affects swallowing and speaking, the whole thing. So I'm praying hard that I kind of come through okay. I guess I only get shot. I mean, the radiation shot's only like a minute or a minute and a half long, but it's radiation, right? So it's a cumulative effect over weeks, and I'm getting this for 7 to 8 weeks, 5 times a week, 7 to 8 weeks. So we'll see how that goes. Anyway, it starts tomorrow. One other thing that's kind of new is I started up a new band. Excuse me. Obviously, I don't plan on doing any background singing, but I figure, we practice one time a week for an hour or two. They give me something to focus on when I'm just sitting around the house. I try to do gaming, but I had a bad experience with it, and I just kind of dumped it. So that's for kids anyway. But I figured it'd give me something to fill my time. But so now I have I have a rhythm guitar, so I'm gonna play lead guitar and probably some rhythm guitar. I'm on Band Mix, which is a thing for musicians. It's just a website. You can go in there and give a quick thing about yourself and what you're into and what you like to play, what your capabilities are, what your equipment is. And you kind of hook up with other bandmates, and you send them messages too. So I sent a bunch of messages to a bunch of people and saying, hey, look, I'm going to start up this band. I don't even know what kind of music we're going to play. It's probably rock oriented or blues because that's what I'm into. But I don't really care. I mean, as long as it's, I like all music. So, and also on Veterans Day, I started my master's program again. So I got my bachelor's degree. I finished last February, and so I figured, I got this next couple of months and sitting around the house, I might as well, take advantage of the downtime and start my master's program. So that's what I did. So I'm taking Ethics 501. That's my first class. It's online. It's all online, which is pretty sweet. So I don't know. We'll see how that goes. I just submitted my first paper 4 days ago on Veterans Day, and it hasn't got graded yet. So I don't know. I'm trying to feel out what this professor likes and what they don't like. The format of the paper is important. It's APA, but every professor kind of has their own little thing on a couple of quirks they usually have. So I'm curious to see. And I have a big paper. I have a 4 to 5 page paper to write. That was only a 2 to 3 page that I submitted. But I'm kind of holding off, finishing off my large paper, or actually doing my large paper, until I know what her isms are, right? So I can figure her out, and then I can kind of format it to what she likes and what she doesn't like. So that's where we're at. So now let's talk about the elephant in the room, shall we? So I am wearing these glasses. I got these glasses. I had a cheap pair. I wore them out to the desert a bunch of times with work and traveling and climbing on tanks. And finally they got broke. They're like $5, right? But these ones, I figured I'll go to Walgreens, whatever, cheap, whatever pharmacy glasses, right? But these happen to be Foster Grant. So they're like they're $21. So I try to take care of these ones. But no, the real elephant in the room is this, right? I figured, what the heck? I was messing around on Amazon one night, and I came across this hairpiece, and it was like $15.95. And I'm like, hey, I mean, you looking at the pictures, I mean, it was on like a, what do you call those, mannequin head, and other than being a little bit poofy on the top, maybe that's just my little pointy head. I don't think it looks that bad. What do you think? I mean, I'm not that vain. I'm not gonna. I don't know. It's usually the back is the teller, right? You see how it is? I don't know. Anyway, what the heck? Figure $15, give everybody a laugh, right? And last but certainly not least, Big Sis. Guess what? It came. So, again, she said I should be scared. But then later on, I said, I am kind of scared. She's like, what do you think I'm going to do to you? I'm your sister, you clown. So, but I think, so, like I said, we might be on different ends of the spectrum philosophically and politically. So like I said, I pulled that little President Trump thing on my little sis. So I wouldn't put it past my big sis for trying to pull something on me. Maybe a Pocahontas shirt. Something like that. You know what I mean? So this is interesting packaging. By the way, very well done on the package, sis. Nice job there. And we got Cinderella of Boston. I don't know what that is. My sis lives on the outskirts of Boston. That's pretty much where I'm from, right? Here we go. We're opening her up. Uh-oh. So it says, you think you know me? It says, just in case your head gets cold. Aw, did you actually get me something nice? Did you? Did you? There's some other stuff in here I think's for my big brother. I might have to take off my hair to put this on, if it's a hat. What is it? What? She says, well, I do know her. Look at that. It's got hair and everything. That's pretty sweet. We got to try her on. Hold on a sec. I'm going to take her for a spin. Dig it. Hey, sis, look at you. Look at you. Hold on a sec. I guess it's one size fits any little head, huh? Look at that. Right? Trump 2020. I love it, sis. Look at that. I'm going to actually wear that around. I'll probably get the heck beat out of me, huh? maybe people have pity on me because it actually has the hair. So, uh-oh, hair's falling out. Sis, I dig that. Thank you so much. I should have known you'd get me something funny. I dig you, sis. I appreciate that. Thank you so much. So, that's it. That's it for now, guys. We got the hat reveal. We got. We talked about me peeing. I mean, where else can I go with this? This is pretty much done. So, anyway. Oh, I got one last thing for you. Last time when I said, "Hey, we're out in 4, 3, 2, 1," and I hit this button, if you notice, there's no blue light on here. It didn't work. That was all Hollywood antics. When I pushed the button, nothing happened. Maybe I'll put it in as blooper at the end of this, but I was like, "Hey, did it work? Oh, what happened?" So, let's try it again. I don't think it's gonna work. We're out in 10, 9. Just kidding. Let's see. See? It didn't work. But I'm going to make it look like it works. Alright, you guys rock. Hey, thanks for following me on my channel. Stay cool. Stay warm. It's a little bit chilly this week. Matter of fact, I think we're in Arctic blast or something out until like Wednesday. Even here down in Central Florida, it's like 51 degrees. I'm not feeling it. But I got my fuzzy hat on, so I'm good. Alright, see you guys later. Ciao. So, let's see how it works. We're out in 3, 2, 1. Did it work?